Michigan Government Relations Director for the American Heart Association. We are going to be recording this call, so I'm just going to kick it over for a second to my colleague, Alexis.
Good morning, everyone. I'm Alexis Richards. I am the Grassroots Region Manager for the Midwest. So I cover a handful of states, including Michigan. And I'm really excited to have everybody here to learn a little bit more from Collin and the Michigan team about some of the priorities coming up for 2024 and some different ways that we can get involved. So you'll be hearing from both of us in coming weeks and months about different ways that you can stay engaged. So thank you for taking your time this morning, and I'll pass it back over to Collin to kick it off.
Thank you, Alexis. And just so everyone's aware, we do have a Q&A feature enabled on this. So I have some of my colleagues, Matt and Sarah, who are going to help look at questions and kind of direct them. At the end, we are going to leave some time for questions to talk about anything we've gone over here or anything else you would like to discuss. So in this call today, and thank you all for joining, just wanted to kind of give an overview of the Michigan legislature, what the American Heart Association is doing, and where we fit in with our policy priorities from last year and this year going forward. So next slide, Sarah. Well, first, I just wanted to touch on what the American Heart Association is. It's the nation's oldest and largest voluntary organization dedicated to fighting heart disease and stroke. We have more than 35 million volunteers nationwide, and we seek to be a relentless force for a world of longer, healthier lives. Just a little bit about Michigan's political landscape. In 2022, new legislative maps were drawn. So for the 4 decades preceding that, between the governor's office, the state house, and the state senate, at least 2 of those chambers were Republican every year for the last 4 decades. After those independent lines were drawn for the new legislative maps, all 3 chambers, meaning again, state house, the state senate, and the governor's office, fell to the Democratic Party. So now all 3 chambers in Michigan are controlled by the Democratic Party. When they came in at the beginning of this year, and Michigan has 2-year rolling legislative cycles. So while they have adjourned for the rest of this calendar year, they will come back and any bills that haven't been acted upon will still be active. So when they started this year, it was a 56-54 Democratic-controlled state house, meaning a very narrow margin. Back in November, 2 Democratic state reps ran for and won mayoral races, meaning they had to vacate their seats in the state house, making the state house split evenly 54-54. The Democrats still have the power of the gavel, meaning they still get to determine things like session dates, who's on what committees, but any bill that they attempt to pass through the state house needs 55 votes, meaning they would need 1 Republican crossover vote for any single piece of policy to make it out of the chamber. So with that, they adjourned at the I believe it was November 9th, they adjourned for the calendar year. They are coming back for their first day on January 10th of 2024, and they will be holding special elections for those 2 seats of the 2 state reps who ran and won their mayoral races. So the special primary election is January 30th. The special general election is April 16th. Meaning it will be a while before any significantly contentious issues are brought up in the state house. The state senate is a 2018 Democratic-controlled body, and they will too be returning to session on January 10th. So next, I just kind of wanted to go over some policy wins that we had so far this year. So just a couple things with the Healthy School Meals for All was probably the banner issue for the American Heart Association. This was something that AHA kind of led from the beginning. We started the conversations with the governor's office, with the state legislature, with the Michigan Department of Education, and with other interested groups back in November of 2022. So the goal at that time was to get the the recommendation within the governor's executive budget recommendation. So the way the budget process works is that in February, the governor introduces what's known as her executive budget recommendation, which lays out things that she would like to see in the yearly state budget. So the goal was to get the governor to mention this in her executive budget recommendation, meaning it would get a lot of attention from the media, from the state legislature, from other interested groups who wanted to work on ensuring that all students had access to no cost breakfast and lunch. So that's really what happened. We worked with the governor's office. We got inclusion of this within the executive budget recommendation. And that was both the policy and the funding component. So we have the verbiage that dictates what the program does, as well as the funding that puts the program into use. So in July, it was signed into law for 1 year, meaning that for this school year, all public school students will receive no cost breakfast and lunch at school. And any meal debt that was accrued before that time was eliminated. So what we're looking to do now, and I'll get into that in just a couple minutes, but what we're looking to do next is take that 1 year policy win and make it permanent. Another thing that we worked hard on was the SNAP asset test removal. So for anyone who's not aware, SNAP stands for the Supplemental Nutrition Assistance Program, meaning that it is what is commonly known as food stamps. And so one of the barriers that we saw with the ability to access SNAP was that there was an asset test limit, meaning that families had to choose between saving for emergencies or putting food on the table. This meant that if they had a certain amount of assets, whether those were savings, whether it was a house, a car, whatever it might be, they would be precluded from enrolling in SNAP benefits. So we worked with a grantee from the Voices for Healthy Kids team, and we worked with State Senator Jeff Irwin and got that bill repealed. So basically what it means now is there is no asset test on SNAP. What it does is it is determined based on your income. So SNAP is a tool that we know provides a lot of nutritious content to those across Michigan and across the nation. And about 1 in 10 people in the US, 1 in 10 families in the US rely on SNAP. And finally, we worked on for years stroke and heart attack systems of care. Those are pretty complex issues, but what it boils down to is things like facility designation and registries. So we want to ensure that everyone is transported to the right center at the right time for what they specifically need, and ensuring that they are transported properly, and ensuring that hospitals can take them and work on the specific issue that they're facing will save lives. So for both stroke and heart attack, we worked on facility designations. And then for stroke, we also worked on registry, which is compilation of data to look at health outcomes and how we can better serve those who deal with heart attacks and strokes. So in between July and August, all 5 of these issues, so Healthy School Meals for All, SNAP asset test, stroke registry and facility designation, and heart attack facility designation, were were either signed into law or were adopted by the Secretary of the State, meaning that they are currently in place. So those were some of the things we looked at the beginning of the year. Now I want to get into some of the things that we'll be working on and have been laying groundwork since last year, and we will continue to do so. So these are just some of them, and I'll take them in turn. But the first one we're going to focus on is Healthy School Meals for All, the permanent policy. And you can go to the next slide, Sarah. So Healthy School Meals for All is so important. In Michigan, 1 in 7 children goes hungry. And at the core of the American Heart Association mission is the promotion of policies that ensure all people can live longer, healthier lives. And that includes a specific interest in the reduction of risk for chronic illnesses like cardiovascular disease, hypertension, and diabetes. So to mitigate these issues and help to work to prevent them, we must start healthier trends at a young age. And that's why we really led this effort in schools, because not only does Healthy School Meals for All ensure food security, but it helps ensure nutrition security. So what we know from research is that meals served in schools are healthier than meals brought from home. We want to ensure everyone has the ability to be fed these caloric, healthier meals and ensure that they're receiving proper nutrition from the time they're in pre-K through the time they graduate high school. And we know that if they develop these trends, if we start working on nutrition and healthy eating and a proper diet early, those are skills that will translate into healthier lifestyles going forward. So not only do we have the hunger issue, the food insecurity issue, but right now 1/3 of children are not only at an unhealthy weight, but they're also at increased risk of developing heart disease and diabetes. And so really what that means is they now have health conditions that were previously only associated with adults, like high blood pressure and high cholesterol levels. And we know that they are consuming too much sodium and added sugars, and they're consuming too few fruits and vegetables. So we need to ensure that we are providing access to these healthy meals that we know follow strict dietary guidelines. And the American Heart Association has fought for years to ensure that the food that children are receiving in schools are going to lead to healthier lives. So aside from the nutrition and public health benefits, Healthy School Meals for All advances health equity, increases attendance and students' performance in the classroom. It saves families money. It strengthens school budgets. It reduces stigma, and it decreases behavioral problems. So what we've done so far, again, we got this passed for the school year with some additional funding in case it's a little bit more than anticipated. But what we want to do now is put this in statute to require the state to enact this policy year after year. So there were 2 bills introduced, one in the state House, one in the state Senate, that would codify this program and put it into law permanently. So in September, the Senate Education Committee heard testimony on the Senate bill. The American Heart Association recruited members to come and testify there about the importance of this bill and what it would do. After testimony, the bill passed unanimously out of committee and now is on the Senate floor. So as soon as they return for the year, we're going to work to get that policy moved and get it enshrined in state law. And next slide, Sarah. So I next wanted to talk about cardiac emergency response plans and CPR in schools. So sudden cardiac arrest is one of the leading causes of death in the United States. And over 350,000 people experience a sudden cardiac arrest outside of a hospital every year. Of those, only about 40% get the help they need before emergency responders arrive. And really, what we're looking at doing is creating a more robust system of cardiac emergency response plans, which are written documents that establish specific steps to reduce death from sudden cardiac arrest in a school setting. And what we know is that the planning and the utilization of multiple different groups within schools and outside of schools can help reduce deaths in a school setting and ensure that the chaos that comes with something like a sudden cardiac arrest does not lead to an improper or inadequate response. Cardiac emergency response plans are used by school personnel, healthcare providers, boards of education, school safety advocates, and importantly, local emergency service providers to better prepare and react to sudden cardiac arrests. So in Michigan specifically, there is a 2014 law on the books that requires schools to have cardiac emergency response plans. There is also a 2016 law that requires schools to teach CPR and AED instruction as a component of graduation. However, what we've seen across the country and anecdotally throughout Michigan is that many, if not most, schools are not utilizing these laws. So, what we're looking to do is strengthen the laws on the books and provide the adequate funding to ensure these laws are carried out and ensure that schools have the necessary resources to create a nation of lifesavers. So this is a larger package that would encompass cardiac emergency response plans. It would look at the use of automated external defibrillators, and it would look at beefing up the CPR in schools component of graduation. So that's something we've been working for quite a few months on that. And it's something that we do plan on having introduced probably in January, but we're going to continue working on that, and we'll keep you updated as we move it across the finish line. So next slide. We are also leading the effort on easy enrollment. So what that means is on the state tax form, we would add a checkbox that would allow people to check if they wanted to receive information on free or low-cost health insurance. We know that around 65% of Michigan residents who are eligible for Medicaid or for a tax subsidy through the exchange are not enrolled in either of those programs. So really what this does is it connects people with the agencies that can help address their issues. It meets people where they are, and it ensures that we are bringing this very difficult process to them in providing the information necessary to get what they need to get enrolled. So from the AHA's perspective, this is so important because quality health insurance allows you to utilize both preventative care and to manage chronic conditions. So we really want to ensure that everyone who's eligible for these programs are getting these programs so we can ensure that we are doing as much as possible to build a robust public health system with savings and with people really receiving the care that they need to live longer, healthier lives. So we have that bill is currently in the draft form. We're supposed to have it back by the end of this year, and we will have that introduced at some point within the next couple months of 2024. Tobacco policy. So this is a big one. Tobacco is the number one preventable cause of death in both Michigan and the United States. And what we know is that in Michigan specifically, tobacco use kills over 16,000 Michiganders per year. And we are one of the 13 states known as the Tobacco Nation, which is a term for the states with the worst health outcomes from tobacco use. Smoking related annual health costs in Michigan are more than 5 billion, and our youth e-cigarette usage is nearly 50% higher in Michigan than the national average. So tobacco is one of the biggest factors in determining heart health or tobacco use. And we want to ensure we're doing what's necessary to provide the resources and the policies to ensure that Michigan is really taking care of its residents, and that we're really doing what we can to fight against this, this dangerous usage of tobacco. So I have listed here 6 different issue areas. Since October of 2022, the American Heart Association has been working with the Keep My Kids Tobacco Free Alliance, and we have introduced a package of bills that touch on each of these issues, which I'll take in turn. So, tobacco retail licensure. What we know is that it's too easy to sell tobacco to kids. And we really, with the current system, we have no idea where tobacco products are being sold, which means we can't hold retailers responsible for following tobacco laws. Tobacco retailers are frequently located close to schools and highly concentrated in communities of color. And over the last century, the tobacco industry has intentionally marketed and sold their products to get new users addicted and prevent current users from quitting. So tobacco retail licensure is one part of a comprehensive tobacco control strategy. What it does is it creates a retail licensure program in Michigan, which requires establishments to have a license to sell nicotine or tobacco products. It sets penalties for violations of the laws, which include fines and go up to suspensions and license revocation. It would also require 2 annual compliance checks to ensure that these laws are being followed and that products are not being sold to those who are underage. Next, we have the elimination of flavors in menthol. So evidence shows that the growing youth e-cigarette epidemic is being driven by flavored products. And these threaten to addict a new generation of kids to nicotine. The bill here would prohibit the sale of nicotine or tobacco products with what is known as a characterizing flavor. It would establish civil fines and license suspension or revocation for those who violate these laws. What we really know is that children are being turned on to tobacco and nicotine use at a younger age because of how appealing a lot of these things seem. Mint, bubble gum, cake. They can come in very bright colors. They can be advertised right next to the checkout. There's so many things that set this up to have children developing these bad habits at a young age. So really what we're looking to do is enact policy that would prevent these from getting in the hands of children. Another thing we're working on is tobacco tax. So currently, Michigan is one of only 18 states without an e-cigarette tax. This bill would establish a tax on e-cigarettes, and it would correspondingly increase the tax on combustible cigarettes and other tobacco products to meet parity. One thing we don't want to do is create an e-cigarette tax that makes them pricier than buying combustible cigarettes. We don't want to push people out of doing one thing and onto another. And so really we want to ensure that when we're looking at the establishments of this tax, we're raising the corresponding taxes to ensure that we're discouraging this behavior, but we're also taking the new revenue generated from these established taxes and putting them toward tobacco prevention and cessation programs. We also are working, AHA has been one of the national leaders in preemption. And basically, for anyone who's unaware of what preemption is, it's a pretty complex issue whereby a higher level of government can restrict a lower level of government from creating laws or regulating on certain issues. So, on this one specifically, Michigan has a 1993 law that says localities cannot enact their own tobacco policies because the state has the authority to do that. So, what we've seen is that in areas like Detroit and Grand Rapids and Lansing and Washtenaw County, there are groups that have been pushing to work on local issues like the elimination of flavors and menthol, like tobacco retail licensure at the local level. But they've gotten so much pushback on this because there is this law that says localities do not have the ability to do this. So, what we're looking to do is get that preemptive language repealed and replace it with a statement that says localities can enact their own policies to protect their citizens. There's not always a one size fits all approach, and we want to ensure, especially when it comes to tobacco and public health issues, that local experts have the ability to do the right things to protect public health and really lead to the best public health outcomes for those within their residency. So next, Sarah. Double up food bucks. So basically, we talked a little bit about SNAP earlier in the call, the Supplemental Nutrition Assistance Program. But what we're also working on is a program through SNAP called Double Up Food Bucks. And what Double Up Food Bucks is it's a program that allows those who receive SNAP benefits to get a dollar for dollar match on fruits and vegetable purchases. And that's up to $20 a day. So say you go to a local grocery store and you're trying to buy some fresh local produce. If you buy $1 of asparagus, you are going to be entitled to a second dollar of asparagus by virtue of Double Up Food Bucks. We know this program it helps bridge the gap. What we see too frequently with those who are on SNAP benefits, especially after the waivers ended at the end of last year, we saw the waivers end that extended a little bit more flexibility in how much states could offer for SNAP benefits. So there was a reduction for those who are on SNAP benefits. In Michigan, it was an average of about $90 a month. So what we want to see is that we are putting these dollars to as best use as possible and that they're going as far as possible. So rather than buying a can of green beans, we want to ensure that people have the ability to buy fresh green beans. We want to ensure that they have the access to purchase these fresh fruits and vegetables and not be pushed into such a kind of a reductive view of what they can use those SNAP benefits for. So there are myriad benefits from this program, including nutrition, health, and business. Not only does this help local stores, this helps farmers markets, this helps local growers, and it provides an avenue to healthier nutrition for anyone who uses it. So what we're looking to do with this program is increase the level of funding from the state. So the Double Up Food Bucks program currently is funded by a combination of state and federal funds. And what we're looking to do is pad a little bit of funding at the state level to ensure that this program, which is administered by a nonprofit known as Fair Food Network, we want to make sure this program is not pigeonholed. We want to make sure they have the ability to not just stay stagnant, but to increase what they're doing, to provide more benefits and to ensure that they have what they need to get into the largest amount of grocery stores possible. Right now, a lot of the utilization of this program is through local farmers markets, and it's through basically mom and pop shops. We want to ensure that when we're doing this, we provide the funding necessary so that the most people can be impacted by this and that they have the ability to move into larger chain grocery stores and other local grocery stores. Next, Sarah. Paid leave. So the US is one of the only countries in the world without a guaranteed paid family and medical leave program. Only about a quarter of people who work in the private industry and about a third of people who work in state and local governments have access to paid leave. And really, what we've been looking at doing in Michigan through some coalition work is providing a comprehensive plan that would allow for paid time off to recover from an illness, to bond with a new child, or to care for yourself or for family members. There are myriad benefits of this program, but from a heart health perspective, there are a couple that I wanted to point out. So, first of all, when you recover from something huge like a heart attack or stroke, you're going to need more than a couple days or 2 weeks to recover from that major life event. We also know that ensuring proper work-life balance and ensuring that people have the ability to fight chronic stress, which is a big component of cardiovascular health. We want to ensure people have the ability to take the time they need to focus on themselves, on their families, on what they're going through to ensure that they are not suffering from chronic stress related to work and that they're taking care of themselves and taking care of their heart health. And finally, there's a paid leave programs provide an opportunity for new mothers to breastfeed. And that has a number of benefits, but it can improve cardiovascular health for both the mother and the baby. So there have been bills introduced in both the State House and the State Senate to create a paid leave program within Michigan. And back in, I believe it was August, the governor issued her What's Next address. And in that address, she specifically called out that she wanted to see a comprehensive paid leave program passed by the state legislature. So this does have some momentum. The coalition is currently working on some changes, working with interested parties and groups like businesses that are going to be impacted by this to ensure that we can get these through with smooth sailing and that we're ironing out any details that we need to at the beginning rather than dealing with them at the end. Just a couple other quick things I wanted to touch on. There are two regulatory changes that are in the process right now that AHA will be providing comment on. So the first one is a public comment for a proposed Medicaid policy that would ensure 12-month continuous eligibility on Medicaid for those who are under 19 years old. So they just released that call for public comment last week, and we will be sending in public comment to advocate for this change. What we really want to see is continuous eligibility through Medicaid across the board. We want to ensure that everyone has access to this high quality health insurance and everyone has what they need to access both preventative and care throughout the process of chronic disease. The second one is there is a set of draft rules from the Michigan Department of Health and Human Services that would create a centralized chronic disease reporting structure. So as of Monday, they announced a public comment period, meaning people can submit written comment as well as a physical hearing on this policy. So AHA will both be testifying and writing in support of really the inclusion of AHA on a lot of these, as an expert within this group. A lot of what these rules focus around are specific to stroke and heart health. they're specific to hypertension. They're specific to issues that AHA works on a day-to-day basis and has for the last 100 years. So we want to ensure that we're providing quality feedback to ensure these programs do as much as possible to help ensure better health outcomes for hypertension, for stroke, for heart attack. That's what we're working on right now. There are some peripheral issues that get brought up every day, and I'm happy to keep those updated on what we're doing there. But aside from that, I wanted to talk about how those of you on the outside can get involved. The first one, and I'm sure most people here are signed up for it, but what I want everyone to do, if you haven't done so, is text the word MI, like Michigan, to the number 46839 on your phone. And really, what that will do is it will sign you up for our You're the Cure program, and it will sign you up for text alerts that are specific to Michigan. So Alexis Richards, my colleague, got on at the beginning and talked about how you'd be hearing from her and you'd be hearing from me. This is one way that you can directly hear from us. This is a way to get information directly to you with the ability for you to respond to that information immediately. What we frequently do is add an action item to these alerts that would go out. It would allow you to input your name and your address, and then it would come up with a pre-populated message that you would send off to your relevant state legislators. It's very easy, but it goes the distance in ensuring that the voice of public health is heard. So anyone who hasn't done so, I would strongly, strongly suggest you do so now and ensure that you're keeping up and being kept in the loop with Michigan's advocacy. Wanted to make a quick plug for our social medias. So we have our Facebook, which is AHA Michigan, our Twitter or X, which is at Michigan AHA, and our Instagram, which is at AHA Michigan. That's really another way we release statements, we release news, we have when one of us is advocating or a volunteer is advocating through whether it's a newspaper or whether it's through a journal or whether it's through a TV interview, we put those on our social media. We put a lot of important information there. I would encourage a follow on all three of those. And then I just wanted to talk about some ways to get specifically involved with AHA. So there are a number of things that we do that we're a volunteer-based organization. And I, as our in-house lobbyist, I can speak until I'm blue in the face about issues. But really what lawmakers want to hear is the voice of those who are, one, experts, two, very, very interested or have dedicated their lives to this, or three, who have specifically been impacted by it. So one of the things that we seek to do is uplift voices of those who are impacted by policy. And to do so, I need to know where people are, what kind of issues they care about, what kind of issues they've dealt with in their lives. So one of the things that I'm really looking for is we're looking to build a strong volunteer network throughout the state. We're identifying some people through our state advocacy committee, and we have right now 10 members on that committee with the possibility of adding one or two more. So one thing I want to stress is that if you are ever interested in getting involved in the process, I'm going to drop my email address in the chat, and feel free to reach out at any time if you want to talk about how to specifically get involved yourself or with others. But these are just some things that we can do to push forward with heart healthy policy. So action alerts, I've mentioned that a couple times. Signing up for our You're the Cure will allow you to get our action alerts and send them off within minutes. Meeting with lawmakers and staff. Again, I take meetings regularly at the Capitol. And what I really want and what I see the best success from is our volunteers being centered in these meetings. So if you are a volunteer and you have specific interests or learned experience, please reach out. Tell me what we can work on together, and I will help with the logistics to get you in front of the people who can make the changes. We are also looking at doing a potential smaller lobby day sometime in the next calendar year, probably sometime before June. And what that would involve is bringing volunteers from across the state to speak on AHA's issues with lawmakers. So we would get a full day where we would go through a briefing. We would go through how to advocate, how to talk to legislators. And we would put a calendar together of which legislators you're meeting with and why they would be interested in these issues. So that again is something that's volunteer driven, and really we get the best results when we do have our volunteers leading those efforts. So you can send snail mail, you can testify on a bill. That's a huge one. We are going to be testifying within the coming months, most likely on healthy school meals for all, easy enrollments, paid leave, and we're also going to be working on some issues involving self-measured blood pressure monitoring systems and maternal health. So all of those we're going to have the ability to testify on pretty early. And what makes the most sense is getting the experts there to testify on these things. So if you are an expert or if you know of someone who's an expert, please send them my way. We can talk about how to testify, what you would be doing, what it entails, and then we could work together on writing testimony that would best show why these policies are necessary and why they are the right policies. Calling your lawmakers, that's another one. Frequently what we do with our boards of directors in Michigan is we get them to call their lawmakers and say why a specific issue is important. So that's something that we can easily do. Talking to me, I can figure out who your state legislator is. I can write a script. I can provide you talking points. Really hearing directly from someone and knowing that they took the time to make this call rather than shooting off a quick email, it goes that extra mile. But another thing that we've seen that's been very effective in both Michigan and other states is letters to the editors. We want, and we're going to have for the Healthy School Meal for All program, we're going to have letters to the editor from volunteers, from school officials, and importantly, from students. We again want to uplift the voices of those who are specifically impacted by these policies, and hearing from them directly gives the best case for why a policy is necessary. You can help us recruit new advocates. And again, this is something that I'm a little bit newer in this. I've been here for about a year. I've met a lot of volunteers since then, but really across the state, we need to know who is an expert in specific issues. Who's an expert on systems of care work, who's an expert on acute chain of survival issue, who's an expert on nutrition issues. We need to know that so that we can have a robust set of volunteers who are ready to go when it's necessary to further a public policy proposal. The spokesperson is another one that's very important. We've identified for a couple issues AHA volunteer spokespeople who really can be the face of that issue. Again, it's my job to help connect people to their lawmakers, but it's the volunteers who are going to drive home that message. So I want to be a conduit in order to get the people who need to be in front of the legislators or the governor's office or the departments. I want to be the conduit to get you there. So with that, we're going to be talking about some other issues, some ways to get more involved, and we're going to be sending out updates through our You're the Cure network. But Sarah, you can go to the next slide here. I'm going to be doing a follow-up message to everyone who registered for this event. So what I want to do is going forward, I want to host an event on a You're the Cure live event every 3 to 6 months. And what that would entail, I want it to be left up to the volunteers. I want to ensure that whether they want to have an advocacy 101 training or a lobbying training or a government 101 training, whether they want to hear about our specific issues, whether they want to have experts or medical experts come on and talk about specific issues. We want to know what will best serve the volunteers and what you really want to hear. So I'm going to be sending a follow-up poll to everyone who registered asking what you want the next event to look like. And with that, I think we're going to open it up to questions. Matt and Sarah, I don't know if we had anything specific that's been brought up throughout the process, but happy to answer questions now.
Nothing at this point, Collin, but if anybody does have a question, feel free to pop it in the Q&A and we'll be happy to answer it.
Yeah, so thanks, Matt. There's a Q&A section at the bottom. If you have any questions, feel free to throw them in there and we will get to as many as possible. Anything that you also have, I'm dropping my email in the chat. And I want to make sure that everyone is comfortable reaching out to me at any time to, inquire about our policy positions or what we're working on or how they can get involved. I just want to make sure everyone has the ability to have a direct connection to me. And really, I want to get you involved as much as you would like to be involved. So please do not hesitate to reach out. And I have it there again, but signing up for our action alerts, I actually forgot to change this usage of Cure, which would sign you up for the national alerts. If you want to be signed up for the Michigan specific alerts, text the word MI to 46839. All right. Well, if there's no other questions, we will go ahead and give everyone a couple minutes back in